Hi there, my name is Dr. Jonathan Greenburg, and I want to speak to you, the medical profession and the doctors and such, because I feel that for far too long there's been a separation. There's been like two camps. You've had your medical professions that know that the CPAP works 90 to 100% effective. Then you have people, the dentists, on the other side with oral appliances going, I hate the CPAP. We don't want our patients to use the CPAP. And we know the oral appliances have never worked well. And so what my goal is to be bridging both the medical profession and the dental profession together, because there are solutions for both. What my practice does, my office does, and we have 4 offices in the Los Angeles area, and we're starting to expand nationwide with some just great solutions for the medical profession. And so this is what I'm about, and this is what I'm doing. This is what we're trying to get out there. One of the most exciting things that we're doing right now is something called the OPAP. Now, the OPAP has actually been around for about 10 years. You might not be familiar with it, you might be, but it's never been marketed well. And I think part of that problem has been because the OPAP has to be done by a dentist. Impressions have to be taken by a dentist who typically doesn't want to know anything about the CPAP, even though it works great. The medical profession and the DMEs could not really do much with an OPAP because they couldn't take impressions on a patient. So basically what the OPAP is a great new interface. Instead of having a mask like this, or the nasal pillows, or a small oral mask, straps and such, which you know so many of your patients won't tolerate. In fact, your female patients, most of them won't tolerate any of this because, as you know, it leaves marks on their face when they wake up in the morning. And what woman between 45 to 65 wants to do something that will put more marks on her face? And of course, with these masks and stuff, a patient is meant to sleep on their back. Anytime they move, the mask will leak. That's why the nasal pillows are better, but they're still strapped in. Well, this OPAP is basically an oral device. In fact, this is what the OPAP looks like. Now, the OPAP is very simple. It goes into the patient's mouth. One of the ingenious methods to the OPAP here is that the air comes in the front and it actually goes out the back of the throat. It doesn't come in right in the front, which would make the whole mouth dry and make it very uncomfortable for a patient. But the air is jetted straight to the back of the throat, making it very effective and very efficient. But the biggest thing is the patient can now sleep on their back, they can sleep on their side. This is huge. No more air leaks. The patient can go like this, no fear of leaking air, no more straps. It goes in and is incredibly comfortable. It fits just like this. It's that simple. This, you simply hook the hose, attach the hose right to here. The patient doesn't need to do anything further. This is exciting. I think it's one of the most exciting things in the market. And we anticipate that it will, over time, become the most popular #1 used interface for the CPAP machine. And this is part of what's so exciting and what we want to bring to the entire sleep apnea community. We know how high the non-compliance rate is over long term for the CPAP users. You know, a certain number won't use it from the start, and then you get fall off in 1 year, 3 years, and 5 years. Well, with this, we can think of how many patients' lives we can now save. And that's very, very exciting. And we're loving how the medical community and the dental community will now bridge together. Now, as exciting as this is, we also have been experimenting very successfully with another area. And that is for those patients that will not tolerate the CPAP at all, regardless of the interface. We actually have the first legitimate alternative to a CPAP. Now, what I've invented, and this invention has been about 1.5 years old, is this appliance right here. What is unique about this appliance, and what's different than every other oral or dental appliance on the market, is every appliance on the market goes in the category of an MAD, a mandibular advancement device. As you are well familiar, it cranks the jaw forward, but doesn't address the tongue, one of the biggest causes of sleep apnea. So the minute that patient puts their head back, even though the jaw stays forward, the tongue still falls back. And that's why the tremendous failure rate with most of those MAD, mandibular advancement devices. Well, by doing this appliance right here, this horseshoe is what my patents are on. So when a patient places it in their mouth, they go like that, the tongue just sits right here. As they put their head back, the tongue falls right here, and just like a horse collar, the tongue can't fall back anymore. We have an 85% success rate with our patients on the reduction of the AHI. We've got more than a 6% increase in the oxygen nadir, and we also have a tremendous increase, more than 10% on average, of the patient's REM sleep. And we do mandatory post-sleep studies on every single patient. One of the beautiful things about this appliance is if we do not have success initially when we do the sleep study, all we have to do is take this horseshoe and bend it down. When we bring it down more, we're getting better angulation at the tongue. We'll then do another sleep study. There's not a single patient we cannot be successful with. So our challenge to you, the medical profession and the doctors here, and listening to this, send us your most difficult CPAP intolerant patients. These are patients, not using the CPAP machine, they're going home, they're walking time bombs. You know what it's about: strokes, diabetes, heart disease, all the different avenues, and many more. I'm talking about sending me not your patients that can wear a CPAP, not your patients that can use something like the OPAP to use the CPAP. Let's have them use the CPAP. We know that works great. But for your patients that can't wear a CPAP, won't wear a CPAP, send them to me. We'll get them successful. I'll send you the post-sleep studies. We're here to work with you. We're part of a group team. And I want to get out there because very few of the medical profession, very few of you doctors, even dentists, know this exists. This appliance at the moment is too complicated to get the success that I need to get for our patients. We now have 4 locations in the Los Angeles area. We're in Irvine, we're in the West Side, West LA, we're in Calabasas in the San Fernando Valley, and we're in Valencia. We'll be opening up in Pasadena within the next couple of months. Every dentist working at our locations is specifically trained by me, although I'll probably be seeing your patients myself. We will get success for you for those non-compliant CPAP intolerant patients. We're here for you. Give me a call today. You can reach us at 888-31-SNORE. Also, I would be happy and love to come meet with you. You're welcome to come to our site at any time. See us on any day treating patients. I have nothing to hide. In fact, the more you see, the more you're going to love what we do. We do something the CPAP doesn't do. We retrain the tongue to stay forward during the daytime. So we actually, after 3, 4, 5 months of a patient wearing this appliance, that patient will have a better airway, a larger opening in the airway during the daytime. And this is very significant that I've never seen accomplished by a CPAP machine. We've got exciting things on the horizon. There's a lot of research going on. As more of us see what happens over time, this is going to be just tremendous for what we're able to do now for our patients. So I'm happy, as I said, to meet with you. I'm happy to come down to your office. I'll meet with a group. I can do a lecture. I can show you real data that we're getting every single day on our patients. Your patients will be treated great, and I welcome you to even come to our office and see what's going on. Thank you.